Does Japan's culture explain its low COVID-19 numbers? As the COVID-19 pandemic spreads and the numbers of infected and deaths skyrocket in various locations around the world, an ongoing puzzle has been the comparatively slow rise of those numbers in Japan. One key reason for the low number of infections recorded is that Japan has imposed strict criteria to be eligible for testing, focusing on giving tests only to people who have had sustained fevers for more than 4 days combined with overseas travel, close contact with an infected person, or long symptoms severe enough to warrant hospitalization. The goal of this approach has not been to identify all infected people, but rather to focus resources on those most in need of treatment and to trace clusters of infection. It has also been reported that Japanese physicians have been using the country's ample supply of computed tomography scanners, or CT, to identify the pneumonia that is a common result of the new coronavirus, which is then treated, but often without a test for COVID-19 being done. Thus, some people being treated for what is likely COVID-19 won't be counted as confirmed cases in the statistic. Could culture be the explanation? An additional explanation is that Japanese cultural practices may be behind the relatively slow pace of the epidemic here. An example of this viewpoint is a viral tweet which has racked up over 42,000 likes as of this writing. It lists the culture of wearing masks, very little skinship, such as hugging or shaking hands, not wearing shoes in the house, cleanliness of public toilets and restaurants, and clean water and air as potential, and finally the Hamabi, the legendary Japanese mermaid that protects the people from epidemics. That's explain the puzzle of Japan's low coronavirus numbers. One cell biologist cites masks, lack of speaking on public transportation, few religious assemblies, and the fact that few foods are eaten with bare hands as weapons in Japan's disease-fighting arsenal. Despite the World Health Organization's continued advice that healthy individuals do not need to wear masks, many experts in the United States are now recommending that widespread usage of masks be considered, based on data showing their effectiveness in blocking airborne droplets that carry the virus and the fact that many who are infected with COVID-19 are asymptomatic. Theories of Japanese exceptionalism could indeed be dangerous if they breed a sense of complacency or even invincibility that causes people to slack off on social distance. Cultural factors working against testing. One cultural element working against testing may be that some people could fear that a positive COVID-19 diagnosis would lead to them causing trouble for others, something that is strongly frowned upon in Japanese culture. There may also be the concern among Japanese that catching COVID-19 would lead to being viewed negatively by others. This is because in Japan there is often a tendency to blame people for getting sick, assuming that it was somehow their fault. Some people may also have concerns about being the object of discrimination after receiving a COVID-19 diagnosis. Sadly, there are many examples in Japanese history of intense discrimination against and ostracizing of people with illness, including those with Hansen's disease and tuberculosis, and against the survivors of the atomic bombings.